Welcome back. Have you had the latest COVID-19 booster? What about the flu shot? The latest guidance is to take them together. But there are also other vaccines that Zoomers should be getting to prevent difficult and possibly debilitating bouts of illness. If you have questions, we have a guest with the answers. The numbers to call, 416-360-0740, toll free 1-866-740-4740. And now I'm joined by pharmacist Molly Yang, Director of Pharmacy Innovation and Professional Affairs at Whole Health Pharmacy. Hello, Molly. How are you? Thanks for joining us.
Hi, Libby. I'm doing well, thank you. Happy to be here.
Thank you. What is your sense of the take-up of both the COVID-19 and the latest flu shots?
Yeah, that's a great question. I think that, as we've seen throughout the pandemic with each new COVID vaccine, unfortunately, we've seen less and less interest with each new one. But this is why it's so important for us to talk about it, right? Because each new vaccine is a different vaccine, and especially this season, it's been formulated to specifically target the most common circulating strain right now. So it's really important to get everyone up and vaccinated. When we take a look at some of the metrics, only 18% of Canadians received the last COVID vaccine. So we know the vast majority of Canadians are due for the latest vaccine.
And what do you think is holding people back?
I think it's, maybe it's a bit of mixed messaging in terms of how quickly things have evolved, and with the new vaccines, maybe not being aware of how they differ from previous vaccines. And I know it can be very confusing for patients, too, to keep up with the latest recommendations as to which vaccines, how many you need, and when to get them. We've tried to simplify it as much as possible now, through the pandemic. So definitely now, for most individuals, you are due for your vaccine, at least, if it's been 6 months, usually.
One of the things that I've heard is vaccine fatigue as opposed to vaccine hesitancy, where people say, hey, I already got 5 shots. That's enough. I don't really get that. But what do you make of that?
I think, Libby, that is great to point out, because I think it definitely makes, it's definitely on people's minds, and it does make a difference as to the changes that we see in vaccine uptake. It can be challenging after 4 years of the pandemic and after 6 or more doses that you think you're already protected. But from what we see in the data is that, if you got a vaccine, or even if you got COVID, we see that protection waning or decreasing relatively quickly within a few months after that dose. So that's why it's important to stay up to date. And your original vaccines that you got a year ago or 2 years ago are definitely not going to be able to protect you from the latest strains, because they're constantly mutating, right?
Let's take a call from Elise in Tiny Township. Hello, Elise.
Hi there. I was hoping that you could give me some information about vaccines for immunocompromised people.
Yeah, that's a really good question. It can be a little bit more complex for immunocompromised patients, especially around, making sure that you get the right vaccines and at the right time as well, because depending on the medications that you're taking, or if you're immunocompromised because you're taking medication, sometimes you have to time those so that you can get ideally the best response to those vaccines. But generally for immunocompromised patients, the recommendations are to receive obviously the flu and COVID vaccines and your general routine vaccines, but also immunocompromised patients will probably be recommended hepatitis B vaccination, shingles vaccination, pneumococcal vaccination, and meningococcal vaccines. But it's important because it may differ between each individual in terms of what's prioritized, so it's important to speak to your healthcare provider to make sure they can schedule that for you.
Okay, and so that would be like for an oncologist?
Yeah, so depending on... Exactly. So if you're immunocompromised because of cancer, definitely speaking to your oncologist and being able to schedule those vaccines when it's best for your treatment.
Okay, and so I have sort of had a preliminary conversation with one of the colleagues of my oncologist, and they sort of said don't have any live vaccine, but just to talk to my family doctor about it. So
Yep, so that's fine, and you can definitely follow that advice. And in general, that's a really great point that you bring up. For anyone who's immunocompromised, it's not recommended to get any live vaccines. The good thing is that the vast majority of vaccines are not live vaccines.
Sorry, which vaccines are live vaccines?
There are some live vaccines. For example, some travel vaccines like the yellow fever vaccine is live. There's a live version of the flu vaccine, but in general, the ones that we have publicly funded, so flu and COVID are definitely not live, and the ones that we want to focus on, especially for older adults, like shingles, RSV, pneumococcal vaccines, those are not live.
Okay, I want to give the numbers out again, and thank you for that call, Elise. 416-360-0740, toll-free 1-866-740-4740. And I'm talking to Molly Yang, who is a pharmacist and director of pharmacy innovation at Whole Health Pharmacy, about vaccinations. We've just had a call about vaccination for people who are not immunocompromised, people who are immunocompromised, for people who are not, one of the recommendations is to get those vaccines together, the COVID and the flu. A lot of people have questions about that. I have to say that both my husband and I did that, and no problem at all, Molly.
Yep. We have a long history of, throughout COVID, giving COVID and flu vaccines together. And even before COVID, we've given flu vaccines with other vaccines at the same time. And I actually just today got my COVID and flu vaccines together on the same arm. And so it's completely safe and it's effective to do that.
So before we move along to some of the other vaccines that are important, just give us a sense, a lot of times people don't, for instance, take the flu seriously, but it really can be debilitating, especially for older people, and there are quite a big number of deaths every year from the flu, but people also lose their independence.
Yeah, that's a really important point to bring up. Oftentimes when we talk about vaccines, especially for older adults, it's not just focusing on the fact that it might prevent that acute infection, so just preventing the flu or COVID or RSV or whichever one we're discussing. We're really talking about, beyond prevention, can we lessen the severity if you do happen to get flu or COVID or RSV? Can we make it less severe than you would have experienced if you weren't vaccinated? And we know that, especially for older adults, you're at high risk because of the way your immune system ages, right? And along with aging tissues and the presence of other chronic conditions, it really makes that perfect storm as you age to increase your risk of severe infections while you get the infection, but also those long-term complications. And that's what we want to avoid as well.
Okay, I'm going to take a call from Don, who is driving in Toronto. Hi, Don.
Hi. How are you today?
We're fine. Go ahead. You're on the air.
Great. Okay, tonight I'm getting my COVID-19 shot, my 7th one, and so far they've all been Moderna. Does that matter? Number one. And I've never had a flu shot in my life. So why should I get one? Or should I?
Yeah, that's a really good question, Don. So I'm glad to hear that you're getting your COVID vaccine. It's really important because we know that the peak of COVID is coming probably from last year. We know it peaked around December. So getting it in advance of that peak is important. I would also very strongly recommend flu vaccine really for anyone ages 6 months and over because especially for older adults as well, similar to COVID, as we talked about, you have that increased risk of more severe flu. And you never know year by year in terms of the severity of our flu season, and, you don't want to pass it off to your family as well. So I do highly recommend getting them together.
Okay.
Does it matter if I get? So far, I've had all Moderna. Does it matter if I get a Pfizer? I'm trying to get all Moderna if I can.
Yeah, good question. Moderna, so we have two products available this season, Moderna and Pfizer. It doesn't matter if you had Moderna in the past, you can get Pfizer now, or if you had Pfizer in the past, you can get Moderna now. We have no preference between the two products. The only difference is that for children 6 to 11 years old, the only product that's available is Moderna. But other than that, for adults, either product is completely fine.
Don, thanks for your call. Let's go to Lynn in Stony Creek. Hello, Lynn.
Hi, how are you?
Fine. Go ahead. You're on the air.
Oh, okay, I've had 7 COVID shots. Do I have to get another one? The new one or what?
Yeah, good question, Lynn. And you know what? Patients will come into the pharmacy and ask us this. And especially it was relevant in the earlier stages of the pandemic when we were really counting the number of doses that patients received to see whether or not they were caught up. At this stage, because almost every individual has had, various number of vaccines since the start of the pandemic, what we're really looking at is how long it's been since your last vaccine. So if it's been longer for most people than 6 months, it means that that protection from your previous vaccine has likely waned. And so when we see the peak later this season, you might not have that full protection, especially because any previous vaccines you received over 6 months ago, that would have been protecting against a different variant of COVID. So we want to make sure that you're protected this season against the variant of COVID, KP2, or it is KP3, but the vaccines are targeted towards KP2, which is very similar. We want to make sure you're protected against that strain.
So get the other one. So get the new one then.
Yes, yeah, the new vaccine.
Okay, Lynn, thanks for your call. Again, the number's 416-360-0740. Toll free 1-866-740-4740. And I'm talking to pharmacist Molly Yang, the Director of Pharmacy Innovation and Professional Affairs at Whole Health Pharmacy. And we're talking about vaccination and vaccines and COVID and flu shots for older people over 65. There is the high-dose flu, which is more effective for people in that age group, but there are also other vaccinations. So let's talk, Molly. You mentioned the shingles vaccine, and I'm not waiting, but I have to get a second shingles shot. And actually, I've talked to a lot of people who felt sick after getting that second shot. I'm trying to time it on a day when I don't have to do too much.
Yeah, that's a good call, Libby. Sometimes because in the shingles vaccine, there's something called an adjuvant, and basically what it is it's an ingredient that helps to ramp up the immune system, and it's used in vaccines, especially for older adults, because, again, we talked about that aging immune system where older adults aren't able generally to mount as strong of an immune response to vaccines as compared to when you were younger. And so shingles has this ingredient inside the vaccine to help boost that immune response, which is why, and the symptoms that you get after a vaccine is a demonstration of your immune system working, right? Because it's the immune system ramping up. You get that soreness. You feel a little bit of fatigue. You want to lie down. Like those are all signs that the vaccine is working. Because of the ingredient in Shingrix, the adjuvant that helps boost that immune system, it does cause a little bit more side effects than maybe some other vaccines. And so we do recommend if you can take a day or two to relax afterwards, then that would be great. But the symptoms are manageable, and you can, take some Advil or Tylenol to manage them as well.
So, and you're supposed to get the second shot between 2 and 6 months after the first shot, right? Yes,
so it is a 2-dose series. You want to make sure you get both doses. So if you only got one shingles vaccine, you're not fully protected. And we have really strong evidence to show that the shingles vaccine is very effective after you get 2 doses for over 10 years. So in terms of the second dose, you're completely right, Libby. You want to get it ideally between 2 to 6 months. But if it's been longer than 6 months, if it's been even a year or 2 years or more, you can still just get the second dose and finish that series. You don't have to start over.
Okay. Let's go to Elle in North York.
Hi, Libby. So I have a question. I've had COVID in August, and I'm wondering, should I wait 3 or 6 months for my next COVID shot?
Yeah. Elle, that is such a good question. So generally what the recommendation is to wait, as you said, 3 to 6 months if you had a previous case of COVID before getting your next COVID vaccine. If you're wondering if you wait 3 months or if you want to wait a little bit longer and do 6 months, it is case by case, and you can speak to your pharmacist or your other healthcare professionals to see what would be the best choice for you. I would say that if you are at higher risk, whether that's based on older age or if it's based on if you have multiple health conditions or if you have contact with older individuals, if you're a caretaker, for example, for seniors, then that's where I would say, okay, maybe we bump it up a little bit and get you vaccinated after 3 months. But if you want to, if you're not at high risk, then you can wait the 6 months as well.
Okay. Let us move along to Janet in Ajax. Hello, Janet.
Hi. Just a question about the Pfizer. We don't seem to be able to find it. It seems to be Moderna, but we've always had Pfizer and was concerned about switching to the Moderna.
Okay. Yeah, that's a good question. I know that depending on where you are, the COVID vaccine distribution maybe might be different between pharmacies. You can try calling around at pharmacies to see if they have it available. I would say that I totally understand the hesitation if you've only had one type of vaccine. But what I would say is that we have very strong evidence over these past several years of people interchanging, jumping from Moderna to Pfizer, back to Moderna, or vice versa. And it has shown to be safe and effective. So my number one priority to you, if you were my patient or if you were my family member, would be to say to get vaccinated as soon as possible, because we want to protect you before we see that growing peak of COVID, which is coming soon.
Thanks, Janet. Molly, just in our last few minutes, and people, we are still taking phone calls. RSV, my understanding is that it's not a very bad RSV season, and who should be getting the vaccine?
Yeah, really good question there. With RSV, it is a little bit, in terms of the awareness that we have around it, it's a little bit lower. But however, I would still highly recommend the RSV vaccine. It is available for everyone over the age of 60, or if you're 50 plus and you have other chronic conditions that might increase your risk. We see with RSV that, in terms of who gets it most frequently, a lot of the times it's very young children. Infants get RSV, but in terms of who dies from RSV and who gets hospitalized from RSV, those are our older adults, right? So we want to make sure that we protect ourselves against RSV. You can get the vaccine in pharmacies. You do need a prescription. And there's two products that are available. One of them is for ages 50 up, and another one is for ages 60 and up.
Yeah, people are concerned because it's not covered and it's quite expensive.
Yeah, I know. I think it's around $200 or more. It is a one dose, and the data is still developing, but we know for Arexvy, which is the first RSV vaccine that came out last year that some people might have gotten already. If you already got an RSV vaccine last year, you don't need another one this year. Arexvy has data for at least 3 seasons. And the other vaccine that came out this year is called Abrysvo, which similar to Arexvy, but it's indicated for ages 60 and over. We have evidence for 2 years of protection for that one. So you will get several years of protection if you get vaccinated today. So I definitely think it is a good idea to get vaccinated. What
about pneumonia vaccines?
Yeah, pneumonia vaccine, very important for all older adults. Especially, similar to COVID and, what we talked about for all of these respiratory illnesses, We are worried about that acute infection with pneumonia, but we're also worried about that prolonged impact if you ever have pneumococcal disease. And we're worried about hospitalizations and ICU admissions, which we see, especially for ages 50 and over, that increasing risk. So pneumococcal vaccines, if you're age 50 plus, I would definitely ask your pharmacist or doctor about the vaccine. Prevnar 20 is available, and actually, if you're age 65 and over in Ontario, Prevnar 20 is available publicly funded, so you can receive it from your doctor's office, covered by the government. But if you're 50 to 64, you don't have coverage yet, but you still might want to get vaccinated, especially if you have additional risk factors, or if you smoke, or if you are in those high-risk groups that we talked about.
Now, those vaccines, the Prevnar 20, you just get it once in your lifetime, right? You don't boost it.
Yeah, so with Prevnar 20, which is one of the newer vaccines, we have data to show that it has long protection. There were other vaccines previously called Pneumovax, and actually, if you received a publicly funded vaccine in previous years, it would have been Pneumovax. And with Pneumovax, because it was an older vaccine, the technology of the vaccine isn't as long-lasting. So if you had that vaccine in the past, then you may need to get more vaccines in the future, so one dose of Prevnar 20. But with Prevnar 20 now, or Capvaxive, which is the other product, we do know that we do expect long protection from one dose.
I remember having two vaccines, there was a particular order. I had to have one first. So what did I have?
You probably had Prevnar 13, which was the previous vaccine, plus Pneumovax together. But since we have these newer vaccines now that broaden the amount of strains that Prevnar and Capvaxive cover, you only just need the one, either Prevnar 20 or Capvaxive.
So do I need to have another vaccine for pneumonia?
That's a good question, Libby. I would say depending on how long it's been since those pneumococcal vaccines that you had, I would probably recommend it, especially if you have other risk factors, as we talked about, for increased risk of pneumococcal disease, just to make sure that you're well protected through the rest of your life. And
so what would the interval, what should it be?
So generally, after either Prevnar 13 or Pneumovax, you wait at least 1 year before you can get Prevnar 13 or Pneumovax, you wait at least 1 year before you can get Prevnar 20. You can also, if you want to prolong that period, you can wait maybe 5 years after Pneumovax before getting the Prevnar 20, but I would feel comfortable after 1 year. Okay, very good advice. I certainly had my questions answered, as did our other callers. Thank you so much, pharmacist Molly Yang, for that very informative discussion. And people, yes, vaccination is really important. And that is all the time we have for today.
You're listening to an exclusive podcast of Fight Back on Zoomer Radio. Heard weekdays from noon to 1.
Happy birthday to you. Hey, where's Mom going? She hasn't even opened her presents.
Well, son, she just turned 65, which means there's new offers for her at Specsavers.
What?
Yep, an eye exam now costs her nothing, and she can get 30% off lens upgrades with any pair of glasses.
Wow. So, can we cut the cake now?
You betcha.
No-cost eye exams are for eligible seniors at all participating locations with costs covered by provincial healthcare. Conditions apply. See specsavers.ca.
This podcast is proudly produced and presented by the Zoomer Podcast Network, home of great podcasts like Marilyn Lightstone Reads, Idea City on the Air, and The Garden Show.